this is an ultrasound study of a female presenting with the history of amenorrhea for the last 2 months, and now having spotting, has positive pregnancy test, raised beta HCG level. What we see is that this is the longitudinal section on the right hand of your screen. This is the uterus, this area in longitudinal section. Central echoes that you can identify are the endometrial canal. This is the fundal region, anterior myometrium, posterior myometrium, cervix. Small amount of fluid is seen posterior to this encircled inhomogeneous echogenic area. Now this is the transverse section. Now on the left side of the screen, showing a urinary bladder, and this is the uterus in transverse section, and below it you can see a fluid echo-filled, these are echoes, echo-filled fluid cavity with approximately measuring 1.8 centimeter cystic area surrounded by an echogenic ring, which is see, here it is thick, here it is thin. Now, keeping in view the history as well as the lab findings, this is a case of ectopic pregnancy that has ruptured and is seen posterior to the uterus. As you see that the uterus is elevated by this ruptured ectopic pregnancy. This is the gestational sac, and here what you see is this is the fluid. Now this all is fluid with echoes posterior to the uterus, with a gestational sac seen within this echo-filled fluid posterior to the uterus. Let me show you the same on real time. Now this is the urinary bladder, and here is the transverse section, and you can see that this is the sac with echoes within it, thick wall, broken echogenic wall. This is fluid filled with echoes. This is the uterus, this is the endometrial canal, and in longitudinal section we do see that the uterus is being elevated. You can see the cervical canal. This is the cervix. This is the cervix is straight because of this fluid-filled cavity posterior to it. It's elevating the cervix. This is the cervical canal. This is the endometrial canal. This is the urinary bladder, and this is the echo-filled cystic area, which is bleed. Keeping in view the history of the patient and the lab findings, you can see that the uterus is being elevated. So this is a case of ruptured ectopic pregnancy seen posterior to the uterus, that is elevating the uterus anteriorly.